Welcome to Wanja's Health Diary. Today we talk about HIV treatment, HIV access, and also we tackle the prevention question as well. Access to treatment for anybody in this country can be a challenge, but this multiplies greatfold for persons living with HIV. Today on set, we're privileged to have Doreen Moraa Moracha, a HIV and AIDS advocate and also the founder of I Am a Beautiful Story. She's keen to tell us about how do we bridge this gap to ensure that persons living with HIV in this country have access to timely treatment to also enable them carry out their daily activities. Karibu sana, Doreen. We are really honored to have you today.
Thank you so much.
Tell us about your personal story. What drew you to this area? Why are you so passionate about creating awareness on HIV and AIDS?
I chose to be a HIV advocate. I actually didn't choose, rather. Somebody just pointed me in that direction, in that we have a lot of stigma as a country. We have people who are afraid of talking about their HIV status, and we have people who generally fear HIV. We have seen the younger generation who is afraid of pregnancy more than getting HIV. So they told me, why not just use your lived experience, leverage from it, and just normalize the HIV conversation while you show people that this life is possible with or without HIV, and that is how I ended up here.
Stigma and discrimination are really a big part of what would make a person living with HIV not to openly talk about their status. What are some of the forms of discrimination that you have come across as an advocate or even from young people whom you interact with?
I have faced stigma as an individual, but when I was facing stigma, I did not even know why I was being stigmatized. First of all, it started from my relatives because I was born with HIV, and like in most African setups, my parents were the first people to know, and then they ended up telling everybody else about my HIV status without my knowledge. And then later on now I found out, and that is now when I realized the reason why they used to disinfect my utensils is because they were afraid I would infect them. And the reason why they did not want me to associate directly with my other relatives, my other kid cousins, is because they were afraid I might infect them. So there was always that kind of fear that if we get in touch with her, if she gets in touch with us, that whole thing where everything you've done is put aside. It's secluded, things are disinfected, you sit as a place, they disinfect the chair just because I don't know. So with all that, and that time I did not even know why they were doing it. So later on when I actually understood why they were doing it, then now I decided to stay at my parents' place and limit the visitation, because then you don't want to go to a person's place and then make them feel uncomfortable because they're misinformed about your condition. When it comes to the forms of stigma that we have, of course we still have people who discriminate people in terms of sharing utensils, shaking hands. We still have those people doing that in 2021. But we also have people who are now, they're okay, but they want to discriminate you from a distance. In that they're like, I like you, but the rejection type of stigma. But you're living with HIV and all that, so maybe, so you feel that. And then we have people who disclose your HIV status without your consent. That is stigma, because they are telling people you have not given them consent to talk about your status, so nobody has the right to actually do that. We also have people where in circumstances somebody has sex with a person and then they decide to say, I have infected 300 people, and then they put a whole list saying I infected them. So that is a form of stigma, but then it comes also as a revenge porn in some instances. So it just depends on where it falls. We also have now, of course, the dating rejection or pity that comes with it. So people are like, okay, I like you despite your HIV status. You know, you've already cancelled this person and discriminated them indirectly.
Yeah.
Without, I don't know whether people know that that is stigma, but when you tell someone I like you despite your HIV status, you're basically just discriminating them for living with HIV in the first place. So we have all those kind of things. And also we have the mean jokes that people put about people living with HIV and say you don't look like you're living with HIV. And ideally, nobody is supposed to look like the condition they're living with. It does not.
You're an individual.
You're exactly. You're an individual first, so you're not supposed to look like the whole condition. It does not really work like that.
Let's particularly talk about young people and those who are living with HIV. Do you find it particular that women do face higher forms or different forms of discrimination compared to their male counterparts?
As a gender equality activist, I think they do. Why do I say this? And this is straight from the gender card. Because first of all, when women are living with HIV, people expect them to disclose first. The same card is not held out for our male counterparts, like disclose first. We're supposed to understand and be there for them until they get to that point of disclosing. But for a woman, you're supposed to say it first. Why am I supposed to say it first? We are all, my HIV status is my own responsibility. Your HIV status is your own responsibility as a person. So if I decide to disclose, then that is good. If I do not want to disclose, that is my business. But until it comes from a point where there is the understanding where you meet in the middle and then you decide, let's confirm, are we living with HIV or are we not living with HIV? Because I believe disclosure is supposed to be a two-way street, not a one-way road. But most of the time it falls on the woman's part in that, why did you not disclose earlier? We also have, when it comes to women, the prevention methods for women. I find them, we have just one prevention method. So far, the official prevention method in Kenya is just one, the female condom, which when you look at even how it's created, it's not appealing. It is expensive. We know that more women don't, like the economic capacity of women as compared to men is not equal. So how am I supposed to afford a 300 shilling condom when we have a condom for 50 shillings for male? So why is my own condom not being sold at 50 shillings? Women
That's
are
like 6 times
the price.
No, that's actually 30 times more, because a pack of 3 is probably about 10 shillings, which is about like what, 10 cents if you're looking at the dollar. Yeah,
exactly.
And $3 for a female condom.
It's expensive.
Yeah,
it is expensive. So you see, from that perspective, it takes, and then it has taken at 40 years to come up now with the dapivirine ring, which also is not yet accessible in Kenya. So you see, still the issue, the burden goes back to the woman. When you look at the numbers, more women are living with HIV than men. More young women are getting infected with HIV than men are. Why? Because these women are not economically empowered enough to be even able to negotiate for safe sex.